Testing, testing. Sound good. All right. Hi, everybody. Both in the room and call and response. Okay. And online. Welcome and thank you for joining us for this really important panel. My name is Julian Gonzalez. I work for Earth Justice here in DC as Senior Legislative Counsel. I'm here as a facilitator and on behalf of the Water Equity and Climate Resilience Caucus, a coalition near and dear to my heart, of which Earth Justice is an ally. Real quick, I'll tell you a little bit about the caucus and then a little bit about what we're going to discuss and our amazing panel. So the Water Equity and Climate Resilience Caucus was founded in 2018, and it's a national network of organizations working to address water equity and climate resilience. It centers frontline communities of color and low-income communities located throughout the country. Many of the members have worked on, and in many cases, been personally impacted by the lack of water affordability in our country. Attention to this issue here in DC, in Congress, increased significantly at the outset of the pandemic, before we had a vaccine and when everyone needed to use water to protect themselves from COVID. And to be clear, this crisis of water affordability and access existed a long time before COVID. And the advocates that you'll hear from today will tell you a lot more about that. The crisis stems from decades of disinvestment, of leaving certain communities behind, and of systemic discrimination. However, we have solutions. I've never heard this many people talk about this issue in Washington, DC before, which means folks like our panelists are doing their job and getting folks like me and others here in DC to listen. And we're here to do a little bit more of that today. So again, thank you for joining us for this panel. Today, we're gonna continue this dialogue on water affordability and assistance and hear from two frontline organizations led by women of color who serve communities that may not look the same on the surface, but share many similarities and challenges in securing safe and affordable water. It's going to be a really powerful experience to have all these folks together in one room, on one panel, united in the movement for water justice to ensure that everyone has access to safe and affordable water, no matter where they live. We'll hear from the two leaders of both organizations and then from residents from different communities who will share experiences and challenges with water issues before finishing with closing remarks, questions, and reflections. And on that note, I'll pass the mic to Susana de Anda, Executive Director and co-founder of Community Water Center, to introduce the California delegation with us today.
Great, thank you, Julian. My name is Susana de Anda. I am the Executive Director and co-founder with Community Water Center, El Centro Comunitario por el Agua. I believe clean water is a basic human right and not a privilege. I am here on this panel and honored to be with frontline delegation from California. Simona Magaña is coming from Seville, California. Sandra Garcia is coming from Poplar, Tulare County, California. We're also here with La Familia Perez de las Lomas de Monterrey, Monterey County in California. We're also joined with Josie Nieto from Seville, Tulare County, California. And we're honored and excited to be here to join forces with our ally organization of We the People of Detroit to push for increased funding to ensure that we can solve our national drinking water crisis. We can solve this. We're here to also call to action for legislation to create a permanent national low-income rate assistance program in this country. No human being needs to choose whether they pay for water or for food. We can solve that. In addition to that, we're here to advocate to ensure that public policy is engaging with us, frontline communities, to ensure that we create programs and we fund programs that respect and respond to the need on the ground. I come from California, where right now over 1 million people are exposed to illegal and unsafe levels of drinking water in their tap water. I come from California, where people have to worry that their children don't swallow the water they use to brush their teeth. I come from California, where mothers have to ensure that they take bottled water in their kids' backpacks so they don't drink tap water in school. I come from a state that we've done a lot of good work, but we still need a lot more work to get done. We passed in 2012 the human right to water that guarantees in California, all Californians the right to access safe, clean, and reliable drinking water. But to this day, we are not fulfilling that dream. We must include affordability as part of that equation to implement the human right to water in California. In 2019, we passed SAFER, targeted funding to address the need, interim and long-term strategies in California that also funds operation and maintenance and technical assistance. We need more money for that. We can solve this. Water is a we problem. It's our collective effort. As humans, we deserve to have this basic right met right now. I have the privilege of working on the ground with residents that for decades can't drink their tap water because we have contaminants like nitrates, arsenic, TCP, chromium, new and emerging PFAS. And on top of that, we're paying for some of the highest water rates for toxic water. So often, many residents are paying 10% of their household income alone just for water. And on top of that, they have to get alternative water supply. We can solve that. Today, you're going to hear directly from two women who helped pass these two very important bills in California, and who are also founding members of the Agua Coalition. Agua stands for People United for Water, Asociación de Gente Unida por el Agua. It's a grassroots coalition that has been meeting every month for 17 years to address our crisis in California, to bring solutions to water contamination and now water affordability. Studies show if you live in our region and you look like us, we have higher chances of having polluted water. Race is the #1 predictor of who has good water and who doesn't. Work with us to solve this. Sandra Garcia is coming from Poplar, California. She has lived firsthand the importance of making sure that resources come to our communities to drive change. She then took it upon herself to not just be an activist, but also to be a local water board member. She will highlight the obstacles and opportunities to drive change on the ground. You're also going to hear from Simona Magaña, a powerful woman who owns a private well that has been dealing with technical problems with her pump because of overdraft of groundwater sources and land subsidence. Her well went dry. For a long time, she had to haul water from the neighbor's hose, and it wasn't potable water. It was just running water to wash dishes, to flush the toilet. She's here to tell you that it's important that we include people on domestic wells as part of the solution and resources. With that, le voy a pasar la palabra a Sandra Garcia. With that, I pass the mic to Sandra Garcia directly.
Hola, mi nombre es Sandra García y yo vengo de la comunidad de Poplar en el condado de Tulare y fui miembro de la mesa directiva local de agua. Y como miembro de la mesa local se me hizo injusto que para poder agarrar un programa para limpiar nuestro agua, nuestro pozo, teníamos que subir la tarifa de agua. Pagamos ya $100 por nuestra agua. Entonces ya doble, el pago era dobles, eran 200 al mes. Y nosotros no podemos pagar porque como campesina trabajé 40 años piscando pepino, coliflor, uva, de todo. Entonces en los campos no tenemos tanto dinero, nuestro trabajo es temporal. Por muchos años oía a mis compañeros decir que algo nos estaba haciendo daño, también a mí, yo también sufría. Entonces no sabíamos qué nos estaba haciendo daño. Nuestros mayordomos llenaban sus yogas con agua de la casa de ellos sin saber que nuestra agua estaba contaminada con nitratos y que era el agua que nos estaba enfermando. Y por años sufrimos y nunca sabíamos qué eran los nitratos, qué era, porque nomás nos sentíamos enfermos del estómago. Entonces nosotros necesitamos mucha agua porque ahorita en este tiempo sube la temperatura a 110. Se nos terminan nuestros galones de agua y van y llenan el galón otra vez con agua del rancho. Y por eso les pedimos que nos incluyan en un programa federal, que nos ayude para que no nos corten el servicio de agua. Necesitamos que nos tomen en cuenta. No queremos que nos regalen nada. Queremos que nos ayuden porque pagamos bastantes taxes. Entonces, siempre nos gusta trabajar y poder pagar nuestros biles porque es un orgullo mexicano que necesitamos trabajar y nos gusta nuestro trabajo del campo. Entonces, pero necesitamos un programa permanente que pueda ayudar cuando tengamos problemas y no nos dejen sin agua por falta de pagar un recibo por un mes porque tenemos que pagar la conexión otra vez para atrás y otra vez doble recibo. Como campesinas necesitamos que los que nos representen vean nuestro sufrimiento, nuestros problemas, nuestra economía, que no es tan buena, y la contaminación no es un desastre natural. Necesitamos propuestas que nos ayuden y respondan a las necesidades de las comunidades en desventaja, y hay muchas comunidades como la mía. No nomás soy yo, hay muchos que no pudieron venir, necesitamos su ayuda de ustedes. Apóyennos, porque nosotros ponemos la comida en la mesa y nos trabajamos en el tiempo de frío, los dedos se nos quieren quebrar porque el frío que está, el calor, que son desastres naturales, pero así trabajamos y no nos rajamos. Ayúdenos, necesitamos su apoyo.
My name is Sandra Garcia, and I'm from the town of Poplar in Tulare County. I served on my local water board as a member of the local water board, and it felt unjust to be able to have to raise the rates because of the issues that we were facing in our local water board. Folks were originally paying $100, and we had to raise the rates double to $200 a month in order to treat our water. For 40 years, I worked as a farm worker. I worked getting grapes, working in many different fields across the area. And that work is temporary work. It depends on the season in which the fruits are available. So it doesn't pay much, and it's also temporary. It doesn't always come when we need it. That work is also very hard work. We didn't know when we were working out in the fields, but we started seeing our colleagues getting sick, and we didn't know why. We started to think about it, ask questions, and what we started to realize is that the bosses were bringing water from their houses. They were filling up tanks from their houses, and that water was likely contaminated with things like nitrate in that water. And we started to see over and over people getting sick. When you're working out in the fields at 110 degrees weather, you need water. You need to drink water. And so we would go through water very quickly, and they would start filling up the water from the fields as well. I'm here to ask for support to include us in federal programs, permanent programs that will allow us to help us pay our water bills. We are not here asking for a handout. We are here asking for support. Culturally, we really appreciate working hard and making sure that we're paying our taxes. It brings us joy and it brings us pride to work hard and provide for our families, and also provide for families around us. Water contamination is not a natural disaster. This is not something that is happening naturally. Many of these contaminants are as a result of large agriculture. As farm workers, we feed this country. We work in fields that feed many people across the country, and we're here asking for support, asking for federal programs that support us with our water bills. Thank you.
Le paso la palabra a Simona.
Buenas tardes. Mi nombre es Simona Maraña. Vengo de la comunidad de Sevilla, California, del condado de Tulare. Represento la la colisión de agua y soy propietaria de pozos privados. Como soy propietaria de pozos privados y así hay mucha gente campesina y tiene muchos problemas con los pozos, porque el mío se secó, tuve cerca de 2 años sin agua. Mi esposo estaba entonces, hace como 5 años, mi esposo estaba recién operado del corazón abierto, y así iba a traer agua del vecino, y yo metía con cubetas para bañarse, para el baño, para lavar trastes, para todo. Y le sufrí mucho, porque también se nos vino el calor y no funcionaba el aire, el cooler que se le echa agua para que refresque en la casa. En la noche salíamos a echarle agua, en el día, en la noche, y me daba tanta tristeza que no podíamos, porque mi esposo estaba muy enfermo y muy delicado, pero así seguíamos, y me daba tanta tristeza que me ponía hasta a llorar, de ver que decía yo, pues si estamos en un país que según es el más rico del mundo, ¿y por qué pasa esto? Que no tenemos recursos, pues duré mucho sin agua porque no hay recursos para nosotros los pozos de dueños de pozos privados. Nomás mandan del federal, pero para nosotros no hay, para las comunidades no hay dinero. Y quisiera que nos ayuden y pues nos ayuden para que haya fondos para nosotros. Como yo, hay muchas familias en las mismas condiciones que estoy yo. No nomás yo hablo por todos los que tienen, y somos campesinos también, somos gente humilde, y nosotros también de gente humilde, de bajos ingresos, que no podemos, pero hay Dios, con la ayuda de Dios, ahí salimos adelante, pero se necesita la ayuda. Como estamos, quiero que ustedes se unan a nosotros para ayudarnos. No, estamos unidos, pero queremos que se unan ustedes con nosotros para apoyarnos y seguir en la lucha, para seguir saliendo adelante, pues que haya las soluciones, pero yo pienso que sí se puede. ¿Sí se puede?
Sí se puede.
My name is Simona Magaña. I come from Seville in Tulare County, and I represent, as a member of the Agua Coalition, I represent other communities as part of the Agua Coalition. I am somebody that has a domestic well. There are many of us that have domestic wells, and many of us are farm workers. For 2 years, my well was dry. And this happened at the same time that my husband had open heart surgery. We had to go to our neighbor's house to bring water so that we could flush our toilets, so that I could clean our clothes, so that I could make sure that he had clean clothes after his open heart surgery. It was hard, and for many nights, I felt like crying. It was hard to understand that living in a country like the United States, which is supposedly the wealthiest country in the world, that this was happening to me and my family. How was this happening? Many of us with domestic wells feel very much left behind. And like me, there are many of us, and I'm speaking on behalf of all of those families. Farm workers who come here humbly, working to make sure that we have solutions for people like us. I'm here to ask for you to join us. We are united, and we're coming here united, and we ask you to join us in our cause. I think we can do this. Now, what do you think? Can we do this?
Yes.
Yes, we can.
¿Qué quieren que les traigamos o qué quieren ver para que nos hagan caso? ¿Qué les gustaría que trajéramos a los enfermos? ¿O ir ustedes a ver las comunidades cómo están?
¿Quieren más, qué evidencias quieren para traerlas o que vayan para que miren cómo vivimos, cómo el sufrimiento que ellos no, ustedes no saben lo que uno sufre, estamos con mucha necesidad, como yo, que se descompone la pompa, es otro gasto, y de dónde, y si se seca otra vez, ¿qué voy a hacer? Porque con la primera, ahí tengo la deuda que debo, de un préstamo para hacer el pozo nuevo. Y si se seca otra vez, ¿qué? No sé a dónde me voy a ir o qué voy a hacer.
We ask you, what evidence would you like us to show? Would you like us to bring evidence here, or would you like to come out and see what's going on in our communities? Right now, our communities are suffering. Simona was talking about how her well went dry, and that was a big cost to her family. And right now, she's paying off that debt. But the fear is right now, will that pump go dry? Will that pump go out? Will the well go dry? Will they need to re-drill a new well? Those are extreme costs, and those are things that aren't that easy to replace.
Thank you, Simona, Sandra, and Anna. Now we'll pass to Monica Lewis Patrick and the folks from Blue People Detroit.
Thank you so much for your peace and blessings, everyone. And first of all, just would like to say how grateful I am to the Community Water Center. They have been an amazing ally and friend. We have learned so much through our relationships over the years. Definitely working on and understanding at a deeper level that water issues are not just isolated to the urban core, but they are also central to what is happening to the disenfranchisement and the lack of water security in our rural communities. One of the things that we would like to do today is to make sure that nobody leaves here not understanding very clearly that water is a human right. We will not apologize for telling all of you that you cannot continue in these United States to shut off people en masse and not have the results of public health impacts, displacement, the loss of homes, and the loss of children. Yes, I said the loss of children. In the state of Michigan, if you don't have running water for 72 hours, you're in imminent danger of losing custody of your children. The only place that we see them use this policy is in communities of color. The other thing that we want to make sure that you don't leave here with any confusion about, we're not waiting on anybody to rescue us. We're not waiting on a handout. We're here to ensure that we get a check that has already been written. One of the things that has happened in the city of Detroit, and I use Detroit because the other thing, many times we are used as an example of harm, but we have also led the nation in solutions. The first water affordability policy in the nation was drafted by our mentor who just passed away last month. The Honorable Councilwoman Joanne Watson, along with the legendary leadership of the Honorable Councilwoman Marianne Mahaffey, drafted the first legislation in the nation in 2005. Detroit, for over a quarter of a century, has been fighting for the human right to water just based on affordability. When you look at not just Detroit, but look at Michigan. Michigan has over 200 communities right now. We sit on the Great Lakes. We sit on water that actually provides a water source to 23% of the water that is consumed around the globe. We also sit on a waterway that we can actually walk out of our houses and touch in the city of Detroit. So in that very same community, we have seen water rates go up over the last 40 years, over 258%. If you go down the street and down the highway to Flint, Michigan, Flint, Michigan's water has gone up over the same period of time, 320%. If you go down that highway and keep traveling about 3.5 hours to Benton Harbor, Michigan, they have had all of their lead lines replaced because they were dealing the last 6 years with contamination. But what do they have now? As we have seen every pipe replaced in that city, they are looking at over the next 5 years, seeing their water rates increase 10% every year. I don't know about you, but where I'm from, that's not affordable. The other thing that we know, in Detroit in 2016, you had an epidemic. So before we had a pandemic, we had an epidemic. You had an outbreak in southeastern Michigan to such a great degree that it was the most documented cases of hepatitis A in American history. But they still kept cutting our water. You had in 2015, we demonstrated, and we the people of Detroit, because we couldn't wait on government. We couldn't wait on anybody to respond. We created our own community research collective. What that community research collective demonstrated, in 1 year alone, we lost 15,000 homes. Not because poor people don't pay their taxes, because they could not keep up with the ever-increasing cost of water. So to have residents of color lose their homes, not because of any fault of their own, but because their government at every level had failed them. When you look at our national contribution to water, up until 1977, the US government contributed to our water infrastructure, about 67 to 69% of what was invested in water. Once they began to divest from water, what do we think happened? That budgetary shift shifted from the national government to the state, from the state to the municipality, from the municipality to the individual ratepayer. But I can tell you as a working mother, my income has not kept pace with that increase. There is nothing more disturbing to the human spirit than the fear of walking door to door in your city as you have thousands of households with no water. As you are talking to mothers that are knocking on doors, just asking for a cup to make formula for their baby. To have a senior who is trapped because their body is failing them in a house or in an apartment building, which is what we dealt with. 2 weeks of an apartment building with disabled citizens in it with no access to running water and an elevator that did not work. I don't know about you, but we can provide testimony because I know to the poundage how much a gallon of water weighs because I've had to carry it. It weighs about 8.3 pounds. If you need enough water for 3 days just to wash your face, bathe, and flush your toilet, it is taking you about 80 cases of water. If you have to figure out a way to ration water, see, these are things I shouldn't know as a resident of these United States. I have sit with mothers that will cook their children's breakfast, and the water that they boil, they will then take that water and recycle it. And in the water that they use to prepare their children's breakfast, that water then will become the water to wash the dishes. And then after they wash the dishes, they unhook the pipe under their sink and they capture that water. And then that becomes the water to flush the toilet. So as some folks, political folks, may want to decide that poor folks don't deserve water, that they're just wanting a handout, I would say no. They're wanting their fair share. They're wanting their human right. They're wanting their dignity. We know that children miss time in school. We know that workers miss time at work when they cannot meet their basic needs of just their hygiene. But for us and we, the people of Detroit, the most fearful thing for people of color is that even when you cannot keep your home, because we lost our homes, you cannot take my children just because I cannot afford them. And so we deputized ourselves. We deputized ourselves because as we saw the EPA fail us, as we saw the federal government fail us, as we begin to make these pleas, even the United Nations, when they came, they said, all we can do is tell you a story. In a global pandemic, Black people made up 14% of the population of the entire state of Michigan, but we made up 40% of the deaths. And I want that to sink in. So that meant almost 1 out of every 2 people died. We saw whole families wiped out. And do you know, in the middle of that crisis, The first 6 months of it, we had to plead with our mayors and our governors, and even make petition with all of our colleagues to the national government just to turn the water. You cannot be declared the leaders of the free world, and you cannot provide this basic necessity to your residents. We must make life water. Low-income water assistance program, you're not doing us a favor. You're sustaining the nation. You're sustaining the nation. We were even able to provide research that demonstrated that if you keep the water on, it actually generates more revenue. So even this misnomer that somehow you're gouging the system, that you're taking from others, that you're leaving it debilitated, that's not true. And then when you look at our children, in 2018, lead contamination was so pervasive in our schools. Just in the city of Detroit, they shut down over 100 schools. Till this day, our children still cannot drink from the water fountains in their schools. What do you think that desperate small children do after they play? Do you think that they're heeding that sign that's on the water fountain? Or do you think they're not drinking out of that sink in the bathroom if they're thirsty? We are. And many times we're not in that room to be able to say, they can drink it. But you know they're coming from homes where the water is off, so they're dehydrated. We have had counselors and teachers and caseworkers actually lose files conveniently so that they will not have to remove children from their homes. Because they know that it is not parents being derelict in their duty, that they economically cannot keep up with this burden that has been left on families and children and workers. So I have brought with me today some of the greatest leaders that advise us as we the people of Detroit and work in coalition and leadership around this work. They are some of the most phenomenal women because they have given their lives for this work. I have Rosalind Osborne. Rosalind, would you stand up, please? Rosalind is an amazing young woman who has worked for years around food justice in our community. When Rosalind realized that families were not only suffering from food insecurity, but water insecurity, she united around that fight. I have with me Nkege Brown. Please stand up, Nkege. Nkege is an exceptional young woman who is pairing the rights for mothering justice with the water justice movement. She has been significant in helping us understand how significant water is to maintaining just good health for pregnant women, for babies. Thank you so much, Nkege. I have with me Attorney Morel Humphrey. Morel is the National EJ Legal Fellow. She also is a member of the Michigan Water Code. Thank you so much, Morel. I have also Mother Queen Gwen Howard. She co-chairs the Water Peace Coalition, and she is also a member of the Michigan Water Code. And then with me, sitting here at the table, is none other than Professor Gwen Winston, who is the Executive Director of Wisdom Institute, and she is also a significant leader in the Michigan Water Table. And then I have to her left, we call her the GOAT. She is one of the greatest experts in our city and our state on the issue of water affordability. She is actually the person that took the policy after our council member, the Honorable Councilwoman Joanne Watson, helped draft that legislation. She operationalized the first water affordability program in the nation. And that is none other than Mother Cecily McClellan. We will try to do our best today to give you every fact, every figure, every story that will leave this room and everybody on the other side of that door totally deputized that everybody must become a water warrior. We cannot leave this building the same way we came. So for us, Mama Gwen, would you just talk about the work that you have led around reproductive justice and how critical water is women's health and mental health. How do you do that?
When we first, the Wisdom Institute first began working on water affordability, the water affordability plan, it was out of the stark reality that Black women, women of color, were having our water shut off. Afraid to say anything to anyone because they knew their children could be taken away. And so it has been a challenge for voices to be lifted. Well, we talk about, when you mention the well went dry, what we know is the well of American politics is dry. Of the people, for the people, by the people, is translated into capitalist economy that's concerned about money. The more money that is removed from our community, that is not invested in our community, is totally a digression from other people, for the people, by the people. I just can't get over that concept of being left out of the whole notion of this, why we're here today. An affordability plan for people's lives. And when we, Wisdom Institute, began engaging more on the ground, we asked a question that helped us to elevate thinking. We asked, what happens to the womb when she has no water? And people would step back and say, can you imagine? Water is life. This country is pretending that it is concerned about life. So we tied water with reproductive justice. Now tell me about water. Speak to me about water. Speak to me about reproductive justice. So the Wisdom Institute moves our work through the rubric of healing justice. There is no healing. There is no justice unless it is attached to healing. We've been wrong in America. We've been wrong. And we often hear about the soul of America. So Wisdom Institute is found African American women, Black women, are the soul of America. You misspoke. Legislators, you have misspoke. If you have not turned that water on, if you do not turn that water on now, what are you talking about democracy? What does that mean? It's empty on the streets. But democracy and justice somehow has passed us, somehow has left us out of the equation for life in America, for livelihood in America. What we know is that in times past, we hear a lot about body, mind, spirit, right? That gets preached all the time. We say, African American Women in the Wisdom Institute represents, say, no, this is about spirit, mind, body. If your policy is not immersed in spirit, mind, body, you're not talking about our lives. And we must do this work as you indicated. When Monica says deputize yourselves, we must always say that in our public, in private, because we are traumatized in America. We are in pain in America. And save ourselves in America, we connect like we're doing.
This is common ground for all of America. And we recognize that when you talk about tax dollars of the people, for the people, by the people, we contributed to the coffers. We are the coffers. Pass legislation and don't rewrite it after you pass it. That will give us our whole lives, no less, our whole lives. We want you to, of course, and has been demonstrated, we know all about the head part of policy public making. We know all about the head part. You gotta bring up some of this hard part that is soulfully American or pretended to be America. And the last thing I want to say that we decry systemic racism. It's brought up all, yeah, you heard it, it's systemic. What we do not hear are solutions that we have explained to you over and over and over again. It is a question of money. It is a question of whether you decide to spend money that will produce products or money that will instead make deep connection to the people of me. We will know that when it happens, because we will see it next door, down the street, around the block, in the community, in the county, across America. Do something for America's people, our lives, children, our community. Water is life. I don't know how any politician can divide that out of the state of beingness in America. I just have to believe. Cecily, based on the work that you've done for Cecily, based on the work that you've done for now a couple of decades, could you just share the significance of your work, especially around the fact that we were seeing seniors and families losing their homes, and the work that you've done or did to build that division to try to help get that relief, and why this money is going to be so important? Continue some of that, please.
No, we believe that water is a human right, and that no one in the United States should have to make a decision between food, rent, and whether or not they'll have water. As it has been mentioned, this struggle didn't start last year or the year before then. This struggle in the city of Detroit for water, affordable water, started probably early 2000. In about 2003, we already had 40,000 residents living in the city of Detroit, surrounded by water, and as one of the other panelists said, in the richest country in the world, that could not afford their water, and they were being shut off. We had a utility that was very harsh toward its residents, and implemented policies that were unfair, policies that did not care about an individual's income. All it cared about is that if you didn't pay your bill, your water would be shut off. And it didn't make a difference whether you had children, it didn't make a difference whether you were a senior and you needed water. for your medication and just for survival. It was about, if you didn't pay the water bill, it was shut off. And as a result of the Honorable Councilwoman Joanne Watson, who spearheaded the implementation of the Detroit Residential Water Assistance Program in 2007, through funding that nobody in the city of Detroit knew was available. You know, these funds were being ciphered off. They were using penalties, late fee, and much of it being paid by the people that were being shut off, being ciphered off into a fund. And that fund had created about $5 million. And as a result of the efforts of the Councilwoman Joanne Watson, half of those dollars were allocated toward the Detroit Residential Water Assistance Program that was funded in 2007. And that program went on until 2012. But as a result of the financial crisis in the city of Detroit, the program was shut down. And there was no continuation of that program. That is one of the reasons we understand that to have a permanent funding source is mandatory. Incomes may not change. You may be, unfortunately, low income, you know, the rest of your life. You may be on a fixed income all of your life. And particularly in your golden years of your life, you need to know that the necessity of having water running in your household is affordable. And that's what the struggle has been. Since that time, you know, one of the things that I have had opportunity to also do is that once the bankruptcy was implemented in the city of Detroit, there was a massive shutoffs. So we were going from 40,000, 50,000, we went all the way almost up to 200,000 people being shut off of water. And that is just, unimaginable. And what we had to do is that we created a hotline and we had people to call in to let it be known that if you need water and your water has been shut off, you know, we will prepare you with at least some level of water. We'll deliver it to your home if you can't come pick it up. And so we began to supply water to many homes in the city of Detroit that had no water. And in delivering to these homes, some of it was really just, it would break your heart. You would go in homes where you had infants and you had mothers that didn't have the capability of preparing formula because their water had been shut off. We went into homes where we had seniors that were ambulatory, or seniors that could not get around, and literally had to depend on us bringing them water so they could then be able to hydrate themselves and maintain some dignity in living. And it became crucially important that, we lobby the city of Detroit and say, we need an affordability program. We need a program that is permanent. And unfortunately, it took the pandemic with COVID, that the city realized that, hey, we can't just shut off this water. We have people now that are living in these homes that are going out, providing services, working in fast food restaurants, working all over the city, and they're leaving homes that don't have access to water. So the spread of COVID just becomes even more greater. And as a result of the moratorium, that brought some minimum level of relief to the residents of the city of Detroit, that they could be guaranteed some level of water. But it's not a permanent situation. And as that moratorium was lifted in December of last year, now we're facing shutoffs again. And we know we have possibly 60,000 residents that are in danger or could be shut off. And although they have implemented a program that is a step in the right direction called the Detroit Lifeline Program that services individuals that are low income, moderate income. It's a wonderful program, but it's not a permanent program. It's dependent heavily right now on LIHWAP dollars. If those LIHWAP dollars are not continued, that program will terminate. All of those people, we have about 20,000 people registered in that program right now. Those people will then now be forced to pay the extremely high rates of water that Monica has just indicated. The water rates in the city of Detroit have risen over 250% over the past, 20 years. So, we believe that our efforts together, working with the Community Water Center and other advocates for water, that we can make it a reality that Congress will make sure that the LIWAP dollars are allocated and will be continued to be allocated for the residents of the United States. Thank you.
Thank you all for your comments and sharing your experiences. As you all have heard, these are issues that have been going on for a long time. There are no stats I can give you that are more powerful than those stories that y'all just heard. I have a lot of those stats if it's helpful. You can come find me and I'll share them with you, but we need to work together with folks here in DC and Congress to figure out how the federal government can support these communities that are owed that support. These stories from Detroit and from California are stories similar to experiences you'll hear from folks in other parts of the country as well. At Earth Justice, I work with folks from Alaska on water affordability, on Hawaii, in New York City, where I'm from, in Puerto Rico, where my parents are from, in Alabama. It's very common throughout the entire country, and it's a crisis and it's urgent. And we are working together to urge Congress to work with these folks who, again, as they've said, have the solutions here. All these folks who have been speaking today have done lots of research, have been working with their cities, their states, with members of Congress. We're not starting from ground zero here. This train is already moving, and we're just asking y'all to get on the train with us. We don't have that much time here, so I want to both provide some time for questions in case anybody in the room or on Zoom has questions. So I guess I'll pause there just in case there's anything else. Yeah.
Hi, thank you all so much. Your stories are so powerful and I think really reflective of the challenges that we see across the nation, in California and Michigan, but also in states in other locations as well. So the panelists brought up some really important points about water assistance and a permanent low-income assistance program, as well as water affordability. I'm wondering if you could clarify for those of us in the room and online why there's a need for the federal government to support both water assistance and affordability.
Can you repeat the question real quick, just so people online can hear it? Thank you.
Yeah.
Oh, I get it. The question was about the difference between water assistance, water affordability, and why we need the federal government to provide support on both of those things.
I'm happy to chime in. It's important to recognize that equitable water rates must be discussed and strategized on the ground. It is not okay to have to pay for unaffordable water rates that safe water. So often we hear people are paying some of the highest water rates for toxic water. And so the government has a responsibility to, one, ensure that we have potable drinking water. And while we get to potable drinking water, we have to have assistance, interim relief. Currently, we do have resources, but they're temporary. We need a long-term solution to have a reliable source of drinking water that provides equitable water, that people have equitable water rates. And on the ground, what that looks like is we have resources for other things like cell phones and broadband. So it's not a no-brainer that we can do that for water. All we're saying is that at the federal level, currently, we don't have a universal low-income rate assistance program. Let's create that so that we don't have to get our water shut off, so that we can make informed decisions. And the government can do that for us. And that is why we're here. It's a no-brainer, and it's clear that as a country, every single person needs to wake up and drink tap water without the fear of becoming sick and pay their water rate.
I'm sorry, I forget your name, but. Hi, Simona. Thank you for bringing the voices of domestic well owners into the conversation. It's not a conversation ever had or been a part of whenever I've discussed water rights or water affordability. And I'm just curious to know, one, how does being a domestic well owner, how that adds to your, I don't know if autonomy is the right word, but ability to survive financially, and two, what can we do to have this conversation more, and to what help does domestic well owned community?
Pregunta es, ella no sabe mucho sobre los pozos domésticos. Entonces, ¿cómo podemos trabajar en qué son los requisitos para ayudar a las personas con pozos domésticos? ¿Se puede explicar un poco más sobre la carga que una persona con un pozo doméstico tiene para tener suficiente y sostenible? Habla un poco sobre el pozo doméstico.
Pero ¿cómo?
Yo le puedo ayudar también. Ya. Y podemos hablar de la financiación que agarramos de SAFE, que pasamos en California. So I can help Ms. Simona. I think that's a really great question. In California, we recognize that when we say over 1 million Californianos without safe drinking water, that's an understatement. We have data for public water systems, but we don't have enough data for domestic well owners. So we went out and started testing, and it was alarming, but it wasn't a surprise to recognize that systems and people on domestic well had the same problem, contaminated drinking water. However, in California, before 2019, domestic private homeowners with domestic wells, it was their responsibility to test for their water. It was their responsibility to figure it out and solve it. That's a problem when, for the most part, they didn't cause the contamination. And we all agree that as a human being, we need to have safe and reliable drinking water. So in 2019, we passed SAFER, the first law in California that is bringing 1.3 million a year for the next 10 years to help drive interim and long-term solutions. And it's also funding that's going to allow private well owners to test their water and bring interim relief. So what we need to do, and I love that question, we need to make sure that federal funding, federal resources is flexible, that also allow and bring in solutions for people on domestic well. We're not going to solve it if we only address the water systems. We need to ensure that we're also bringing in private wells, and we can do it. We're doing it in California, and we need more resources. So this is doable. We can solve this, team. And it's important that we're all at the table to work with Congress to design these programs to respect and respond to frontline communities.
And if I could just quickly add to that, it's because of the work that we've done with CWC that it raised our consciousness in Michigan around the fact that we had to unite our fight and not allow water to be determined in Michigan as just a water insecurity issue for the urban core, because then it also gets racialized and bifurcated politically. And so what we did is we took the learning from CWC, began to reach out to some of our rural partners to increase our learning so that we would be able to advocate at our state level and our federal levels for the necessary funding, so they would not pit us against each other. Because oftentimes in the political atmosphere, they like to say that if I give you something, I got to take something away. Our position is that we are powerful, we have more than enough. It's about making proper decisions and prioritization. And so in Michigan, we will not allow them to separate urban from rural. We will not allow them to pit us against each other and to decide that only these people drink and others don't. And so we are shifting that narrative through our collective work across the state with the Water Equals Life Coalition.
And I'd just like to go back to the earlier question in terms of assistance and affordability, because we have been struggling and fighting against that question for some time. Assistance we see as a temporary solution, and affordability is a permanent solution. And that's what we're looking for. We want a permanent funding source that we will, that could fund the water systems throughout the United States for clean, safe, affordable water. You know, we don't want assistance because that's what we've been experiencing, these temporary reliefs. And then once the dollars are gone, the relief is gone.
Thank you. You know, it is time clean water, affordable water flows through money and power. It's time for it to flow to us for justice.
Yes.
So we can do this and we will do it together. Gracias.
Can I just add something real fast? I'm from the community of Seville where Simona is from, Tulare County. You know, we've lived a pretty sad life where we are at. Not only, but it's true what you see of our public, well, I live in a system of the around us. I was without water for a year, maybe 3 months. You're not, I have my own personal story. I don't, you know, we've lived through, I got a granddaughter that's handicapped, that's sick. Doctors have not been able to tell us why, what caused it. My granddaughter's gonna be 18 years old, so when this, thank again to Susana here, I got educated by them that we can't let this happen. We can't let our neighbors be going through what they're going through. We're here to fight for everyone out there, everybody, not just ourselves. You know, and it's a sad thing that sometimes our color or our race separates us. Water should not be one of the things we do not get separated by.
That's right.
We have to unite. Good health for everybody. Thank you.
All right, sorry. All right, thank you everyone for those comments and those thoughtful questions and remarks. We're a little over time, so if everybody would just join me in applauding and thanking our awesome panel. And more importantly, join this awesome panel in working towards the solutions that they're asking for. Thank you.
Se puede.
Sí se puede. Thanks, grab food. Feel free to stick around if you have more questions. We'll be here for a minute. Thank you so much.